Preeti, we'll start. Can we start now? Preeti, can we start now? Can you hear me, Preeti? You could not hear me. No. No, I can still see that same slide only there. Yeah, and then you start talking. Yes.
Good morning, everyone. Thank you for being a part of today's webinar on stress management for underwriters and claim professionals. So let me introduce you to our speaker, Dr. C.H.S. Rani, sir. So Dr. C.H.S. Rani, sir, has over 4 decades of active clinical practice and over 2 decades of experience in insurance consulting and training insurance professionals in underwriting and claims for both
Preeti,
life and
please
health
put
insurance.
on your video, no?
Yes, sir. There is actually a window behind me, so.
Okay, yeah.
So he is a renowned expert in giving talks on wellness and stress management for over 20 years. So let us welcome Dr. C.H.S. Rani, sir. So over to you.
Thank you. Thank you, participants. I must thank your companies also for letting you attend this program in the JFM. But I am sure it is going to help you give out more and more numbers and a better quality once you learn to know how to manage your stress. So we are today going to talk on managing stress. As you understand from the topic, I'm talking of managing stress. I'm not talking of avoiding stress, because stress cannot be avoided. We all think we know a lot about stress. Anyone tells me, today you are looking down, and I say, oh, a lot of stress. You're looking tired, lot of stress. Do we know what is stress? Stress can take 3 days to learn. Let us see the minimum, what we must know about stress. So if any one of you feels that I am not stressed, that person is either telling a lie, doesn't know what is stress, or belongs in Himalayas like a saint. We all love deserts. Even you're all very young, but even those who are diabetics love deserts. If you spell desert backwards, that is stress. Like we all love deserts, we all are stressed, including me. From the time last night, I decided that I have to reach my clinic by 9:15 to conduct this training from here. There was a certain amount of suppressed stress. Will I be able to? Will I not be able to? What will be the traffic like? Entire journey I was looking at Google Map. So that is a kind of a stress. This was a book written before most of you were born in 1970s, Future Shock by Alvin Toffler. He was a sociologist who predicted that the rate of change in modern civilization would accelerate to such a degree that enormous number of people would experience shattering stress and disorientation. What he's trying to say is that technology and the environment will grow much faster than our capabilities will grow. And that, how will it give stress? I'll give an example. I started practice in 1977. That time, I had no pathology lab within 5 kilometers of my clinic. The patients did not want to know what caused the fever on day one of the fever. So I will treat fever for 2 days. Then I will say, okay, let me do a blood test. That test was 5 kilometers away and the report will come in 24 to 36 hours. I had another 1.5 days to find out what is causing the fever. Fever panels were not known. We would do one test at a time. Today, I can get a fever panel report within 3 hours. The technology has changed. My patient has changed. He comes today. Fever from last night. Doctor, what is the cause of fever? So this difference between the technology, the environment, people, and my capability is causing me stress because now I have to answer the patient. What are the factors that are drawing attention to stress in the modern time? Human biological evolution, as I explained just now, lagging behind development in technology and lifestyle. Everyone has noted that a child today, a 2-year-old child, can handle a mobile phone much more smartly than his or her father can handle or even grandfather can handle. Physiological and psychological stress emerges as a result of growing deficit between daily demand and coping resources. Who knows it more than the underwriting and claim professional, where you are told that today's target is so many cases, and being JFM, you have to do 20% more, and you are smart, you are senior, you have to do 30% more. And you feel you are not able to cope. The turnaround time is causing the maximum stress and is actually shaking us up. Research has shown that 70 to 80% of all diseases and illnesses are stress related, right from blood pressure, diabetes to cancer, to allergies, to asthma. It has shown a relationship between lifestyle and stress related disease. Why lifestyle? I always keep saying I am stressed. I never bother to manage stress. My lifestyle is bad. Define stress. So Webster's dictionary, stress is an inability to cope. Any demand put on you, which you feel you are not able to cope. You are an unmarried person and you have a friend, a girlfriend or a boyfriend who wants you to take a full day leave on Valentine's Day, but they don't realize the JFM. Then you are not able to cope. Then you are told, oh, you don't love me. You are a young parent and you have to drop your child to school before reaching office. You cannot cope. That starts the stress. You may think that that is too small an issue to start stress, but we'll gradually see how smaller issues only cause stress, big issues do not. Stress is being forced to accept unwanted change. I am a smoker. I have been told to stop smoking and I don't want to stop. So I continue smoking secretly. Then one day the doctor says, sir, I can see some suspicious patch in your mouth, which is leukoplakia. And now if you do not stop, I am worried of cancer. Now I am forced to stop. It is unwanted change. It will give me a lot of stress. So what I'll suggest to these people, smoking addicts two ways. One is you need to hold a cigarette. A smoker cannot think without holding a cigarette. So I told them, hold a cigarette, don't light it. But then that is stress. You are forced to change something. You are forced to marry against your wish. Or you are forced to not marry as per your wish. Stress is a symptom. It's not a disease. What you feel, the doctors will diagnose stress from that. Any demand, physical or mental, that is placed on your body can give you stress. It's like you have to go to the boss, and since morning you've been hearing boss shouting at everybody, and you have to go and stand there in a corner smilingly, that is stress. It's a state of anxiety produced when events and responsibilities exceed one's coping abilities. I can cope so much, but now I have to do much more than that. Major life changes can cause development of stress. Somebody losing a spouse, losing a parent, losing a sibling is a major life change. In COVID, a lot of people lost their family members. I had a girl yesterday in my clinic who was having chest pain, 21-year-old girl. So for her sake, we made a lady doctor examine her chest, breasts, everything, nothing wrong. Then when I spoke to her, in her family, there were 5 deaths due to COVID in last 6 months. And then she started crying. That is a major life event. Then daily hassles. I work too much. I have 3 hours in clinic, but every day, half an hour before, 15 patients outside. I have another agenda in the afternoon. That is a daily hassle. It's going to give me stress. Stress is personal. Those who don't have girlfriend, boyfriend, for them, Valentine is no stress. If there was a bomb blast in a train, everybody whose relatives or friends or kids traveled in train would be stressed, but others will not be stressed at all. Let's explain stress and why it is required for us, taking example of a tent. A tent is nothing but a useless piece of cloth. Then there is a post or a nail in the ground, there is a cloth and there is a wire. Now, when you put sufficient pull on the wire and tie it to the post or the nail, that useless piece of cloth becomes a tent and it is useful. If you put too much pressure, the wire will break. If you put too little pressure, then the tent will collapse. So this is our life. For us to perform well, we need a certain amount of pressure. We don't need too much, we don't need too little. And that is why I'm saying that stress is must. Stress cannot be avoided. Stress is dangerous when it is unduly prolonged. When there was a flood in Bombay in early 2000, my daughter left in a bus from Matunga King Circle to reach our house, which was 8 kilometers away. 10 hours passed, mobiles not working. The stress kept increasing till she messaged, I am stuck in a bus, I am safe. It comes too often, or concentrates on a specific organ of the body. I'll give an example again. A girl works in a building on 20th floor. She leaves at 8 o'clock. And when she left one day, she entered the lift. Before the lift door could shut, another boy walked in, her office only, but they had never spoken. Now the time that lift took to reach ground floor, this girl is thinking, will he try to molest me? If he does, I will hit him. And to hit him, if he does anything, she braced her body. This thing kept happening every day. On the 10th day, also, the boy had done nothing. But the girl still kept preparing herself, bracing herself. And on 11th day, she goes to a doctor and saying, Doctor, I have got neck pain. Because she was bracing herself every day, tightening her muscles to pounce on him if he had done something. The doctor will do treatment, X-ray, MRI, no cause, unless you ask the girl how it started. So, how do we diagnose stress? Not by the causes, by symptoms. I'll give you one instance. It's around midnight or 11 o'clock. You are going home, and today in that lane, the lights are off. And when you are walking towards your house, you hear footsteps behind. You stop, the footsteps stop. You walk, the footsteps begin again. Now you start feeling little palpitation, little funny feeling in the upper abdomen or epigastrium, and maybe slight beads of perspiration on your forehead. Instance 2, you have just proposed to your friend and you have been told that I will answer on Valentine's Day. You are sitting in a coffee shop, and then when you see the friend coming with a sad look on face, you get little palpitation, you get little funny feeling in the epigastrium, and you get beads of perspiration on your forehead. And the third, you've done a mistake and you are called by the boss, and somebody tells you boss is in a foul mood today. You're waiting outside to be called, and then you get the same feeling again. 3 different reasons the same response of the body. So we diagnose stress by what symptoms we get rather than what caused it. Common symptoms: frustration, irritability, or anger. Feeling stress or overwhelmed. Oh my God, I can't do it. This is beyond me. Anxiety, worry, or fear, not achieving target. Restlessness or agitation. I don't know what to do. Very uneasy. I'm very uneasy. I can't even explain what I'm feeling. Feeling helpless, especially in the time that people are working from home. Everybody knows that work from home times took a toss. So how do we react to stress? Fight or flight response. It is the body's physiological reaction that prepares us for swift action when needed. So all the three instances I told you, in the first instance, in your lane, footstep behind you, you have two options: run or turn back and fight. When there is a girlfriend coming or a friend coming and you know that answer is no, you want to go away from there or you want to shout, why not? And when the boss shouts at you, you also want to shout back, but you cannot. That is a culture. A newly married girl unnecessarily shouted at by mother-in-law. She wants to shout back, she wants to hit out, but her culture prevents her. In all three cases, you have two responses, either to fight or to run. And both of them require amazing amount of energy. A survival instinct to fight or run, they energy, they require you to have faster pulse rate, high BP, more blood sugar, muscles tight, because you need all of this if you have to either fight or to run. It is meant for physical stressors, but also happens for non-physical stressors. Like the first was a physical stress, somebody may kill you in the lane. Other two were emotional stressors. It occurs both for a real threat, like you meet an accident and that is a worry, or a perceived a noise at night behind you. Anger and fear are two emotions specially associated with this stress response. Anger, fear. Anger produces the urge to fight. Fear produces urge to flight, run and hide. What is the response? The response occurs in proportion to the perceived threat. If the threat is small, the response will be small. If you think perceived, if you think stress is big, then response will be big. I'll show ahead how negative thoughts come up. When not used, stress products build up. Over time, this buildup can be unhealthy. So now I'll again tell you, my body is giving me enough of energy to either run or fight. I don't use it. I'll compare it with, I'm sure all of you have either driven a two-wheeler or a four-wheeler. When you accelerate the vehicle, but you do not disengage the clutch, it is still in neutral. You don't engage the clutch, engage the clutch. You keep accelerating, you hear a whine from the engine. That you know is damaging the engine. My body is the engine. For fight or flight, my body is giving me tremendous energy. It's giving stress products. And that energy is harmful if I don't use it. I'll give you an example through pictures. This is our body. We have a heart that very comfortably beats at 60 to 90 times a minute. But when needed, fight or flight, it goes up to 100, 150, 160 and comes back to normal. We have a blood pressure, which is 120/80, but in fight or flight, it goes up to 200 plus also. We have blood glucose. The levels rise because my muscles need glucose to fight or flight. I am bracing my body like the girl in the lift, and my muscles get taut. My breathing becomes shallow because my energy is going elsewhere. And my stomach, which is working like a concrete mixer round the clock to digest our food, now that my blood is going elsewhere, the stomach becomes slow. And that is the cause of you feeling a funny feeling in the pit of the stomach or epigastrium. And then accompanied by that, the fear. Now just imagine all this happening in your body. So much energy coming for fighting or running, and we don't use it, it starts harming our body itself. Body produces stress chemicals. Symptoms of stress reactivity: increased heart rate, increased blood pressure, pounding in the head, increased breathing, vasodilation of arteries to body's periphery, arms and legs, cold extremities, beads of perspiration on the forehead, and increased blood glucose levels. Now, if this happens more regularly, you have resting tachycardia, you have resting hypertension, you have pre-diabetes or diabetes, and you have breathing difficulty. You know, there's a Hindi saying, "मैं इतना डर गया कि मेरा सांस रुक गया." When you are scared, you have breathing difficulty. I am in an area where there are a lot of corporates. Now, in March, we will start getting young people of early 20s coming and saying, "I can't breathe," because he has been given a daily target of calling so many people and then he cannot manage it. The likelihood of ill effects developing from buildup of stress product is dependent on two factors: duration. The amount of time the body's physiology varies from baseline. So all those changes, tachycardia, hypertension, hyperglycemia, occurs for how long, and secondly, how much. If my pulse rate from 70 goes up to 90, I'm okay. If from 70 it goes up to 130, I'm worried. Of the two, duration is more important. So if I'm under stress chemical effect, 6 hours of my working day or home day, then I am more likely to suffer from stress. So what are the diseases that stress causes? High blood pressure, which is responsible for stroke and heart disease, ulcers. All top executives, all CEOs or C-level executives suffer from ulcer because they have so much to cope with, and they also have issues of coping. So people who take no chilies, no alcohol, no smoking still need anti-ulcer medication. Migraine headaches, tension headaches, allergies, asthma, even rheumatoid arthritis. Although rheumatoid arthritis is an autoimmune condition, the relapses or aggravations occur more pertaining to stress, backaches, and even cancer, as I told you in the beginning. Who are the people more at risk? We are divided into type A and type B personality. I am a type A personality. Excessive competitive drive. I will do something which nobody has done. I am very aggressive. I am very impatient. I cannot sit idle for 1 minute also. And I must do 2-3 things at a time. Sense of time urgency. I know that time is getting over and I have to finish this work. Free floating, well rationalized hostility. This you will identify some friends of yours. They feel everybody is against them. And they are very sure of it. They don't even have doubts. No, everybody is against me. And a deep-seated insecurity. With all this, no, will I fail? So these people are perpetually under stress chemicals. Hot reactors, people who overreact to stressful situations. Symptoms of hot reactors, again identify in your friends and try to tell them to relax. They feel anger very easily. They often become anxious or depressed. Frequent urination without diabetes, without drinking more water. Experiencing constipation or diarrhea more than usual. And nausea and vomiting, never eating wrong food. These people are reacting because that acidity is coming because of the stomach slowing down, and all others are stress chemical effects. So there are 3 types of stresses. I'm sure many of you may not have known that there is a good stress also. Then there is a neutral stress and there is a distress. What is good stress? Let's see neutral first. No stress is a bored person. If you say that I have no stress and you believe it, then you are a bored person. You have no drive in life, like boredom. Then Eustress is positive stress. All of you must have sat in a giant wheel. From the top, when you come down, you feel all the stress responses that I told you. Palpitation, funny feeling in the stomach, something is happening. This is good stress. It motivates, it excites, it energizes. You may be very scared coming down, but you are looking to the next round again. Eustress results from accelerating experiences. It is the type of stress you are likely to experience when you receive an unexpected promotion or award. Or today in your company, nobody thought that you will do the highest cases, but you do the highest cases and you get a good letter from your boss. It is a stress before performance. So all of you, I'm sure, have seen Kaun Banega Crorepati. Even Mr. Bachchan, before his performance, before going on stage, if you see, he's standing behind the curtain, but he's kind of semi-jogging. He's moving his hands up and down. A good performer always gets eustress before performance. The stress of winning and achieving, or trying to win. Today, this may be my 19th talk on stress management, but still I have a eustress that I have to perform well, so that all of you who are spending time go back with some message. Distress is negative stress. It crushes, it oppresses, unusual events carried beyond rational limits is a negative stress. It results from losing, failing, not being able to cope. So what is my trick? Is to convert my distress to eustress, because distress affects people in harmful way. The turnaround time ka stress. Just showing this to you, whatever I am saying now is not just my thought. There is a study done. This is called Yerkes-Dodson curve. Eustress gives you performance very good. The middle line is our target. We should be moderately optimally aroused. Distress, very highly aroused, overwhelmed, and poor performance. This is performance, and this is illness incidence. In eustress, illness incidence is low. In distress, illness incidence is high. So from today, your target is to be optimally aroused. Automatic thoughts, as I told you, negative thoughts. There is an event, there is a thought. Just give a small example. We are coming to April. Every companies will start appraisals. So first week of April, you come to your office. In the corridor, you meet your boss who was talking on phone, and you greet your boss. Good morning, sir. The boss does not reply. And you start thinking, oh, I think I'm going to get a poor appraisal. I think my boss is not happy with me. That's a negative thought. After some time, what brought the negative thought is forgotten. You are stressed and you only think of the negative thought. You don't even think that maybe boss was busy, maybe he didn't see me. So negative thoughts always bring on stress. Automatic thoughts are negative. They always appear instantly. They are almost believed despite being illogical. In your mental language, you should always, it is the words are always should, ought, must. It is not that it is persistent and self-perpetuating and repeat habitual themes. Always protect yourself from negative thoughts which have no basis. Today, with social media, if you feel three friends are talking and when you enter, they stop talking, you will still start. First, your thought will be they're talking against me. And then that thought will keep worsening. Bad news are learned. How do you manage stress? So, strategy for decreasing stressful behavior: accept that you are stressed, because only when you accept you can manage stress. Identify what behaviors you have to change in your lifestyle, in your health behavior. Are you a smoker? You have to change. Are you an alcoholic? You have to change. Do you sleep at 2 a.m., spending time on WhatsApp and YouTube? You have to change that. Identify barriers that prevent behavior change. You may have realized that I am doing this wrong, I must change. But that what is not allowing you to change? There are three legs of this tool of stress management: exercise, nutrition, and relaxation techniques or meditation. Time management, we'll talk a little bit on that. Communication skill, change your behavior, change your environment if possible. If you have bad friends, better to look for other friends and move out of those friendships. Create social support, friends and family. Whenever you get stressed, all of us should have one person we can speak to. Remember, sometimes accepting what you cannot change also relieves stress. I cannot change this. Somebody tells me, give me 5 crores, otherwise I'll kill you. I know I can't give 5 crores. So I cannot change it. Okay, kill me. I will not be stressed at all. Exercise burns stress chemicals. I don't know how many of you now in COVID, we all have forgotten to watch movies in theater. Movies teach us a lot. If you have remember seeing Sunny Deol, whenever he gets angry, goes to the gym and punches the bag. He is burning stress chemicals. There was a movie, Ek Duje Ke Liye, in which when Kamala Hassan learns that his girlfriend has got engaged elsewhere, he breaks into Bharatnatyam till he collapses. He was burning stress chemicals. When you shout without reason, you are burning stress chemicals because shouting takes energy. Aerobic exercise 5 times a week. Now you will say, where is the time? There is always time. Everybody's systems go down. Just start walking in the house. Aerobic exercise includes walking, running, jogging, cycling, and swimming. You have a small house, spot marching. You have a big house, you have a room to yourself, and you are working from home. Put on disco music and dance. You have to use your whole body and tire it. 10 to 15 minutes of stretches plus minus weights. Sustain the activity for 20 to 30 minutes. Set small attainable goals for yourself in exercise. Don't say I will go to gym and all. No point in spending 10,000 rupees which you're going to waste. Do whatever you can. Move your body, move all your joints. Remember the PT we were doing in school. Do it in the house. Spot exercise, work from home. Nutrition. Keep caffeine intake to a minimum. We all get addicted to tea. I am addicted to tea, but I am trying to cut down. Move to green tea if you must have 7-8 cups a day. Eat fewer high-fat, high-sugar foods because they always give hyperglycemia, gives you fatigue, but high-calorie food gives you fatigue. Now, I'll just give an example. You take a plate of fruit salad and you take 2 samosas, which will give you a funny feeling in the stomach, samosas. So, avoid oily and high-sugary foods, at least in JFM. Eat meals on time. If you delay a meal, you get onto eating junk food. Lunch is delayed, so let me have chips while working. No, that doesn't work. Smoking has to be stopped totally. And if you take alcohol, take it in moderation. Increase fiber, salads, fruits. Take some B-complex vitamins and vitamin C. Time management, wake up early. Whenever the alarm goes off, you should be waking up a minute before that. That is one indication that you are not in stress. Make a list of things to do each morning or previous night before you go to bed. Prioritize daily activities. Now the priority is only underwriting or claims, but otherwise there also you prioritize what is to be done first. Reduce screen time, not work related. So if your work involves screen time, reduce screen time of watching YouTube videos and WhatsApp messages. Take a book or other reference material when you know you have to wait. System down. Use that time proactively. If you have some other work to do, if you need to speak to someone, you want to read someone, you want to refresh your knowledge, use that when your system is down. Use spare time for other tasks. Allow time for interruption in your schedule. Today you decided I will do 100 cases, but allow time for interruptions. Some emergency in the family, system down, boss calling. Schedule brief periods of quiet time for yourself. You will say there is no time, but believe me, taking 3 minutes off every hour will increase your productivity. 3 minutes for one song will increase your productivity for rest of 57 minutes. Changing your behavior, accepting stress as part and parcel of life. Often our behavior contributes to the stress we are experiencing. Why everybody has to put work on me? Instead of this, I will say, everybody trusts me, so they give me work. Way of thinking. Practice anger control. Very, very important. Remember the golden rule, count to 10 before speaking in anger. Develop social support with friends and family. Talking it out relieves stress instantly. Meditation. What is meditation? Meditation is not a hard routine. Position. Any position you find comfortable. There is no need to sit cross-legged. You can sit in a chair. And if you are alone in the house, you may even sit on the commode and meditate. The position is as per your comfort. You don't have to put any agarbatti, any rose, any red light, nothing. Focus. Meditation is focus. So 80-year-old lady, when trying to thread a needle, for that 10 seconds, her focus is on that needle and thread. She is meditating. If I am examining a child of 1 year, heart rate of 130, I am auscultating 2 heart sounds per beat, 260 sounds in a minute. And I have to see, is there a murmur or is there an extra sound? I have to focus. I have to block out everything around me. That I'm meditating that time. I don't have to sit anywhere. So focus. Prerequisites, you have to be relaxed. Method, I will give you a simple method over next 3 minutes on how to relax. Breathing exercise. We have to do an activity and we have to block our thoughts. So I breathe in, counting up to 4. Deep breathing, counting up to 4. All of you please do. Deep breathing, 1, 2, 3, 4. Now hold inside your chest. 1, 2, 3, 4. Now open your mouth and exhale. 1, 2, 3, 4. Now when I'm breathing and I'm counting, no negative thought can enter my mind. After that, I have a list of 5 people, 5 events, 5 instances in my mind, which will instantly bring a smile on my face. I breathe 2 times. I am relaxed. I think of that person, my girlfriend, my wife, my child, my father, my mother, which gives me a smile. I think of the time I received the first prize in speaking, brings a smile on my face. I am relaxed. Then a negative thought enters. I take 2 breaths again. And then I go to the imagery list. I have 5 people I can think of. You do this 2-3 times, you are enough relaxed to come and take the shit in the world. The key to anger reduction is knowing yourself. Why am I angry? Do important jobs now before they become urgent. Don't criticize, condemn, and complain because it makes you angry. Organize your mind, organize your desk. To-do list for 5 minutes every hour. This 5-minute planning will save you 30 minutes in the day. Even ask stupid questions to avoid mistakes, because mistakes make others angry with you. Never get angry with someone who has nothing to lose, like your senior, your boss. Follow us on LinkedIn, Inches Academy, Inches Healthcare Private Limited. You will be getting a lot of material concerning underwriting and claims and insurance related, and we'll be gradually, periodically holding free webinars for you all. Thank you very much. I have finished at 10:30 sharp. I am open to questions if there are any. And I would request all of you to give your feedback in the chat box. So at least we know that the talk has been effective and it has helped you somehow. Any question? Can I request all of you, Preeti, just put on everybody's video so we can take a snapshot.
Yes, sir. Please put on your videos.
So nobody has any questions, nobody has any comments. I think you are relaxed to at least say something. Dr. Kunal Patil, thank you for being the first person to ask a question. Can stress be person induced and how to cope up with such stress? Yes, stress can be person induced, no? Because you have to then start thinking, is this person intentionally giving me trouble or am I doing something wrong? See, the biggest quality that we can have in life is introspection. It's easy for me to say, अरे वो useless है, वो ऐसा करता है, he troubles me. I have to find out my follies, what is wrong with me, and then I have to change that. So yes, and then the best thing is, okay, now I know, I have decided, I have thought over it, and now I feel that this person is intentionally troubling me. So I tell that person, I would like to talk to you over coffee. Why over coffee? Because when I talk one-to-one, no, my voice goes up. In a coffee shop, I am civil. I talk softly. In my patients, when couples have fights, no, wife and husband, I tell them, go to a coffee shop and talk, because you will never talk loudly. Talk to the person, find out. See, in most cases, no, there is a small misunderstanding that is causing the whole problem, and let's resolve the misunderstanding. Nobody has actually any genuine reason to be enemy of somebody else. And if you are the best in your team and others are jealous of you, then I will say, Kunal, you should be happy that you have arrived. People will only be jealous of somebody who is really good. But it always helps to talk it out. It always helps to talk it out. Okay, so other question is, I think no other question. Thanks for your comments. And I'm telling you, this thing that I gave you, of relaxation, meditation, Gaurav has said more elaborate, can add some breathing techniques. Okay, I will now take 2 minutes, all of you. First, you think, make a list in your mind of 5 things, 5 people that bring a smile on your face, how much ever stressed you are. Now I have my list. I am sure everybody has their list. Take a deep breath, counting till 4. Breathe in. Hold it in, count till 4. Then breathe out through the mouth. Then I think of my first item in the list, my grandchild sitting in Singapore. Then a negative thought enters. I again breathe. The breathing in has to be through nose with mouth closed. The breathing out has to be only through mouth. You are removing all dirty air from your lungs. stress from work from home. So request your office to allow you to come to office. I am sure most of them are allowing to work from office. And work from home, if your work has enough place, make a workstation. Because work from home is giving a lot of problem of neck pain and upper back pain. So doing some exercise, neck exercises, stretches, everything has to be done. So Gaurav, I have taken your clue. Once the JFM is over, we will have a real good session for the teams across insurance industry. Okay, bye. Back to your work. All the best for JFM.
Thank you, sir.
Thank you, everyone. Thank you, sir.
Yeah, thanks a
Thank
lot,
you,
sir.
नाही ऑटोम्यूट होता ना आपला अनम्यूट नाही आहे